Doctor, I have acid reflux and I'm taking medication for my thyroid. Ever since I started taking the reflux medication, I've had a problem with my thyroid. Is there a connection between them? We will answer this question because there is a major drug interaction between antacids and thyroid medications. But we wanted to make a comprehensive video to talk about the drug interactions between thyroid medication in general and all other medications. You'll be surprised today that there are a lot of medications that we take, or a large portion of us take on a daily basis, like vitamins, for example, or painkillers. But they also have a drug interaction with thyroid medication, and we need to know what happens between them so we don't get harmed. And we don't have to make unnecessary adjustments to thyroid medications. Okay, let's start with the simple medications first. Simple medications like vitamins. Now, vitamins that contain iron, calcium, magnesium, folic acid, vitamin K, vitamin A, vitamin D, or vitamin E, all these medications reduce the absorption. The replacement hormone we take in the thyroid pill, which could be thyroxine, L-troxin, Euthyrox, T4 thyroid, depending on what's available in pharmacies. So what should we do? Now, many people take vitamins. They could be children, they could be adults, they might need them. Some people have deficiencies and some take them because they don't eat a certain type of food or have medical problems that force them to take vitamins and so on. We keep the vitamins at least 4 hours away from the thyroid dose. We always like to set the thyroid dose in the morning as soon as we wake up, so we keep the vitamin dose at least 4 hours apart. Of course, there are vitamins that are best taken after a meal, so we take them after lunch. We don't have to take them after breakfast, just take them after lunch. Okay, there are other famous medications, guys, like painkillers, for example. Many girls who have menstrual pain take a painkiller called Ponstan or Ponstan Fort. It's currently out of stock in pharmacies, but it might become available again as it was before. The active ingredient in it is called mefenamic acid. It might be available in the Gulf countries under different names. The brand name might be different. So let's be aware that those who take painkillers for menstrual pain contain this active ingredient. Pay close attention to this point. Also keep it 4 hours away from the thyroid medication. What else is famous? Antibiotics. The most famous one is the active ingredient called ciprofloxacin. It might be available under different names. Sometimes it's available under the same name in pharmacies. It might be available under the name Cipro, Ciprobe, Ciprofar, and Cipromega, and many others. But the active ingredient is ciprofloxacin. Its active ingredient affects the absorption of the thyroid hormone and its dosage. When we prescribe this antibiotic to anyone, we prescribe it twice a day. Most of the time, what do we say? After breakfast and after dinner. Well, if I take the thyroid hormone in the morning half an hour or an hour before breakfast, and then I take this antibiotic right after breakfast. That's barely an hour or an hour and a half between the thyroid medication and the antibiotic. Is that okay? No, of course not. Keep the thyroid medication 4 hours away from the antibiotic so that its concentration and absorption are not affected. Another common type of medication. Many of us take antacids. This was the question we started the video with. Antacids, whether they're the fast-acting ones like Gaviscon, Malox, and Reni, or the slow-acting ones that reduce stomach acidity. The fast-acting ones might contain calcium carbonate, for example, which reduces absorption. There's another important point. Now, stomach acidity decreases with these medications, and we need stomach acid for the absorption of the active ingredient in the thyroid replacement hormone. That's why absorption is reduced. So some people take this reflux treatment for a long time, maybe 2 to 3 months. This is with medical advice. Then there are people who, without medical advice, take this treatment for maybe 6 months or a year, which is of course not right. So when we see their thyroid tests, we find a problem, we find that we need to increase the hormone dosage, and we review the patient's medications and find the active ingredient of antacids, and we work on that. Some patients refuse to reduce it because they don't have the opportunity to adjust their lifestyle. They refuse to adjust their lifestyle and want to take the reflux treatment daily. So we're forced to leave the reflux treatment, change its timing, and increase the thyroid dose. What can we do? We have to make adjustments, but in the end, the patient is the one who suffers. Our concern is to regulate the thyroid properly. So people who take antacids continuously, that's wrong, first of all. They have a specific duration, whether for a stomach ulcer or reflux, whatever the reason, there's a specific duration, and then we stop them. Okay, there are other medications, folks, that aren't very well known, but many people have started using them, like, for example, antidepressants. People who use the family called SSRIs, like Cipralex, Prozac, fluoxetine, and Lustrel. Well, this family also affects the absorption of thyroxine from the stomach or the replacement hormone from the stomach. And therefore, it also messes up the adjustment of the thyroid dose. We must keep a 4-hour gap. What else? Blood thinners like heparin, and only a small group of people take them. May God not command anyone to take it. But some people take them. Blood thinners like heparin. Okay, there are also epilepsy medications. Epilepsy medications like phenytoin have the exact same effect. See how large the amount of medication is? So let's always keep the thyroid medication 4 hours apart from these drugs. So what is the best time to take the thyroid replacement hormone? In the morning on an empty stomach. What does on an empty stomach mean? Because some people say, "Doctor, I can't do anything without having my morning coffee first thing." Let me tell you, coffee and espresso affect the absorption of the thyroid hormone just like the medications we mentioned. People who drink grapefruit juice, same idea. It affects the absorption of the replacement hormone. We must keep it away from the thyroid dose. But it's not always 4 hours. I mean food and drinks, because they don't stay in the stomach for 4 hours. So we can say, take the thyroid medication half an hour to an hour before breakfast or the first thing you have in your day. What's better? An hour. Because for some people, it takes a bit longer for the stomach to empty its contents, so we don't make it half an hour. Let it be an hour before you have coffee. Before you drink your grapefruit juice or espresso, stay away from the thyroid dose for an hour. So, in the morning on an empty stomach. What does that mean? It means on the nightstand next to your bed. You wake up, open your eyes, swallow the thyroid dose, and then go take a shower, perform ablution, or get dressed to go to work. Then you can drink your coffee after an hour has passed since the thyroid dose. Okay, what else affects absorption, folks, in food and drink? There's something called soy flour. Soy is one of the things that can have an effect. Of course, I haven't seen many people use it. It's more common in products specifically for children, but it also affects absorption. Now, we received some questions on our channel regarding the thyroid. Some people asked about the dosage, as we're approaching Ramadan soon, God willing. Happy holidays to you all. We had made a video about Ramadan, and we'll make a new one for you about the thyroid during Ramadan to explain how to take the dosage. We also received other questions about pregnancy. Women who are about to get pregnant or are planning to get pregnant want to know how to handle it. In short, the thyroid dosage is increased during pregnancy by approximately 30%. Of course, you should go back to your doctor. He's the one who increases it. Never increase it on your own, because we adjust it with regular follow-ups to ensure we're giving the correct dose and that your TSH is normal. Someone else asked about how often we do thyroid follow-ups. We do them every 4 to 6 weeks when there's a dose adjustment. And when the TSH test comes back normal once or twice in a row, we can do it every 3 to 6 months. And then every year, unless new symptoms appear. If symptoms of the thyroid appear, whether it's symptoms of an underactive or overactive thyroid, we test again until we get it right, following the same standard of 4 to 6 weeks until it's adjusted. After that, we go back to doing it every 3 to 6 months, and then every year. So those are pretty much the questions we received. We'll make other videos for you about Ramadan and how to take the thyroid dosages. And remember that patients with diabetes and high blood pressure also have a specific regimen for their thyroid dose to avoid drug interactions, and we'll cover that in the video about chronic diseases, God willing. See you later. Don't forget to give us a like if you enjoy the videos. And for those who haven't subscribed to the channel, please subscribe. If you'd like to see our new videos, you can watch the old videos we made. They contain very useful information. And see you later.